So thank you for attending our first webinar in our new evaluation series called Measuring Change. We are going to be first going through some tools and other Bree opportunities, and then we're going to have our presenters from the Puget Sound High Value Network speak on how they've been using them. So a couple housekeeping items. If you have any questions, please drop them into the chat box and we'll be monitoring that in the Q&A. And just to let you all know that this webinar is being recorded. So here's our agenda, just in case. And I wanted to give a quick overview of the Bree Collaborative. For those of you who are signing on from other states or who are not familiar with the Bree, so we were established by a legislative statute in 2021, or 2011, excuse me, and collaborative members are appointed by the governor. They represent public and private purchasers and health plans and health providers, etc. And so far in our history, we've developed over 40 plus guidelines on a variety of different topics. And the Bree was really created to be a collaborative space so that public and private stakeholders could have an opportunity to come together and talk about ways to improve healthcare across the system. And this little flow chart here is just kind of a rough example of the way that our guidelines work in the system and kind of flow down through the healthcare system to create impact for patients and residents of Washington State. So we, in 2022, the Bree was given a little bit more opportunity to start doing evaluation. So our evaluation program is very new, and we really think it's an important part of the iterative process of quality improvement and an important part of our guidelines. We really want to learn more about the impact of these guidelines throughout the healthcare system. So today we're going to talk about 3 different kinds of tools. So we have created these general tools, and they're really to help other organizations conduct evaluations. And then we have these collaborative tools. And then we have report-specific tools, which we started developing last year. So these are really specific to each topic. So our general tools are found in our evaluation tool depot, and they consist of a variety of things. So they're really focused on like education and training to do evaluations and different kinds of templates that you can use for your evaluations. So we have things such as theory of change tools, developing your logic models, to help you kind of get started in thinking about how you're going to evaluate something. And then we also have these different kinds of forms. We've pulled a lot of these from, IHI, London School of Hygiene and Tropical Medicine, and different organizations. We've kind of collected them to help organizations develop the strategies for their evaluations. And then we also have data collection and management tools and some free software available. We recognize that a lot of the organizations that are going to be implementing and evaluating our guidelines may not have the kinds of tools available that larger organizations have. So we wanted to provide some kind of free stuff for them and some support around evaluation. And then importantly, we have some qualitative tools in this evaluation tool depot that are focused around ethical and cultural perspectives in your evaluation. And then, getting more of a patient perspective or getting more qualitative data to support things like understanding the barriers to implementing a quality improvement process. So these can be found on our website. if you go under evaluation, and then you hover over that, and you hover over evaluation tool bank, and you can find our evaluation tool depot there at the end of that list. And so the next type of tool that we're going to talk about are our collaborative tools. And these are modeled on the CDC's question bank and survey bank. So we created one of our own. And the object is really that organizations can come and pull questions off of this to create surveys, or they can submit their own and share them so that you can collaborate with other organizations. Maybe you only have, like 10 people in your survey, and it's not enough to really assess it fully. You can collaborate with other organizations and get together and use the same questions and ask your patients the same things, or ask whoever is the focus of your implementation the same questions, so that you can have a larger N for your analysis as well. And our survey bank is very similar. So this first one that you see here is a completed survey that was developed by ESD 105 as they were doing an evaluation of one of their implementation projects on asthma. And so they have submitted their survey so that anybody else who is doing an asthma care plan improvement project can come and take their survey and see if it works for them. And then our last collaborative tool is our newest one. It's a measurement bank. So this is a place that is meant for organizations to be able to submit things like queries, definitions, numerators and denominators, things like that. So Labor and Industries has already submitted their data elements that they are using to pull heat-related illness from their records. So you don't have to go, digging around and looking up codes and everything like that. There is a bank that is being developed where other people can submit them, and then you can leverage kind of a shared knowledge of different metrics that might not be standardized yet. And so these are in a similar place. They're just above the evaluation tool depot. Those three right there. So as I mentioned, this year we created some report-specific tools, and we asked our work group to create a subcommittee to identify metrics and identify strategies for evaluation. And across our three subcommittees, what we came up with was creating an evaluation matrix and creating an evaluation framework. And so each of the three subcommittees last year created evaluation frameworks that were specific to the topic that they worked on. And this is really a how-to guide of evaluation. So if you are thinking about implementing some things from, say, our OUD disorder treatment report, this can help you. You can find your role, and it will help give suggestions to what you should include, what you should, who you should coordinate with. Lots and lots and lots of information. I think it's quite a long document for each of the topics and reports. So it really gives you these key definitions, standards and principles, resources, helping you set priorities and helping you really think about, your role and who is kind of tangential to your role and might be a good partner for you. Our evaluation matrix is kind of a summary of all of our metrics that have been recommended. So it really summarizes the guideline recommendations by audience, identifies kind of the objectives for each of the components, for example, education or access, and then identifies potential metrics that organizations can align on as they are working on implementing those components. And the scorecards, which Inkaruka and David will be talking about more in depth, how they use them. But all of our guidelines, I should back up. Most of our guidelines have these scorecards available on our website, and organizations can use them for a variety of ways. So they can help you just think about how you are going to implement and how you're going to measure. They can be shared with the Bree, and we will include them in our reports and on our dashboards. And you can also submit them to win awards. And we have multiple award winners. They're listed on our website. Many from Puget Sound High Value Network. And we have 3 different levels of awards. So you could submit these for a Pathfinder Award, a Trailblazer Award, and then if you win a Trailblazer Award, you are then eligible to submit for our Mountain Climber Award, which is around equity, embedding equity principles into your implementation projects. And then the subcommittee also created these theories of change, and it really is kind of a visual of how they imagine that the guidelines that they created will create change in the system. And so you can see this one here is specific to opioid use disorder, but you can see that there's this kind of state level change that they imagine was happening, changes at the organization and changes within the community. And I think that these were really some of the best tools that the work groups came up with. It really helps you visualize what the process is going to be and what the end goal should be for, for this when you go to implement. And so these specific, topic-specific tools are on our website under Bree Guidelines. And if you go down and click on any of these categories, you will find that all of the guidelines under that category are listed, and they have this little section of our implementation guide. And this metrics and evaluation tools section is where these tools are located. So there are other things around here too. There are resources and tools for implementation. There are examples of implementation, and then the information about how the guideline was developed, work group members and materials, etc. And you can also just read the guideline online here. So everything is all in one place for these tools. So that is an overview of our tools. And if anybody wants to put questions in the chat or questions in the Q&A, we will be answering them at the end. So I will turn it over to Inkiruka and David, and they will be talking about how they have used our Bree scorecards and other tools in their project on perinatal behavioral health.
Inkiru, would you like to introduce yourself before we dive in?
Sure, I'm happy to. Thank you, David. So my name is Inkiruka Duze, and I'm an internal medicine physician and also serve as the medical director of Puget Sound High Value Network, and I work very closely with David.
And my name is David Mayo. I am the director of Clinically Integrated Network and Accountable Care Operations at Virginia Mason Franciscan Health, and act as the executive director for Puget Sound High Value Network. And we have had a long-standing relationship with the Bree Collaborative, which has been played an important role in helping to implement care transformation projects throughout our network. And if you move to the next slide, we'll introduce you to who we are. So we are a very robust network of various provider groups. We're almost a network of networks, if you will. So we have 17 hospitals from various health systems, along with various primary and multi-specialty providers with over 10,000 providers throughout the network. We serve in King, Kitsap, Pierce, Snohomish, and Yakima counties. And we're diverse in the sense that, because we have hospitals, we have provider groups, we need tools that can be diverse as well. And I think we have found that through the Bree Collaborative, and especially with our experience in the perinatal behavioral health work. So it can serve a variety of different groups and types of entities. And we found that very useful. We have our Puget Sound High Value Network is primarily focused on public and school employees and the benefit boards that provide insurance to those groups. We offer a narrow network product through them, but we also serve a lot of the non-narrow network population as well. So moving on to the next slide. We have collaborated with the Healthcare Authority to implement various quality improvement with the goal of transforming healthcare, as I just had mentioned. And so the objective of care transformation is to address the populations treated by the Puget Sound High Value Network in our primary population, which is the public and school employees, but it's also really to leverage that as a way to drive change throughout the health system and the provider groups to improve the quality of care for all Washingtonians. This is the first year that we'll be presenting the perinatal behavioral health work, and this is our first year implementing that type of quality improvement plan. So it is been a great experience. We've been very impressed with the tools that the Bree Collaborative offers, and aligning on different initiatives that really will drive healthcare in such a diverse, provider network that we have. So we are grateful for the Bree Collaborative, the Foundation for Healthcare Quality, and all the other partners that have made this possible. And with that, I will turn it over to Dr. Duze.
Well, thank you, David. And if you don't mind, Carrie, moving on to the next slide. I will start with why. So why perinatal behavioral health for our quality improvement project? It's primarily because, perinatal mental health conditions are the most common complications of pregnancy and the first year following childbirth, affecting upwards of 1 in 5 perinatal individuals. Now, recent data from 36 maternal mortality review committees revealed that perinatal mental health conditions are the leading cause of pregnancy-related deaths. And most of those deaths were from suicide and overdoses. Now, 14 of those reports did determine that those mental health-related deaths were preventable. Next slide, please. So why the Bree Collaborative, for our perinatal behavioral health quality improvement project? So just to piggyback on all that David had shared about this partnership, the first is through the Bree Collaborative, you receive evidence-based guidelines that lead to improved outcomes. The Bree also provides framework and tools for implementing their guidelines. And last but certainly not least, you have the opportunity to engage with a collaborative team that is very responsive and supportive. Next slide, please. So we've talked about the why. Now I think it's time to pivot to the how. So how are we using the Bree Collaborative tools for our perinatal behavioral health quality improvement project? So the first step is that we leverage the checklist tool that the Bree Collaborative provides. And their tools essentially help put their guidelines into systems that you can actually use to implement change in your organization. Now, the checklist tools come in 3 levels, and each level corresponds to the perceived level of difficulty for implementing the guidelines. We began our journey of implementing the Bree Collaborative perinatal behavioral health guidelines at level 1. So we started with a level 1 checklist tool for clinicians, outpatient clinics, and birthing hospitals. So what we did was we completed the checklist. We also sent the checklist to all the members of our network to complete it. And the purpose of that was to really get a big picture understanding of the current state of perinatal behavioral health across our network and to also identify the gaps. Next slide, please. Having confirmed that gaps did exist, we needed to take the next step of going deeper. So, and to go deeper to really understand areas of greatest opportunity, we leveraged another tool from the Bree Collaborative, which their evaluation scorecards, and Carrie had shown some examples of that when she did her presentation. So for us, the scorecard provided a framework for choosing our goals for our QIP, and also gives us the framework for tracking our targets and outcomes as we go through this process. So how did we use the scorecard? So we used it essentially to establish our baseline of where we are with the Bree guidelines. So essentially, we determined our baseline score for each guideline, and that helped to highlight to us areas of greatest opportunities. And from those areas, we were able to choose 2 goals. So I'll expand on that on the next slide, please. So how do we use the scorecard to determine our baseline? So this is one example of the few scorecards that we sent out to all our network partners, and we also had to complete this ourselves. So essentially, for each guideline, each network had to complete this form and say, you know, where are we with this particular Bree guideline? Are we at a 0, which is we have not taken any particular action yet on this guideline? Are we at 1 where we've been actually actively considering implementing this guideline? Are we at level 2 or number 2 where we already have some adoption or implementation going on? Or are we at a level 3 where we have full adoption? So each network partner completed several scorecards, and then we were able to use that data to understand, like, first of all, where are all our opportunities? And after looking at what all our opportunities were, what were the greatest areas of opportunities? And that is how we were able to arrive at the 2 goals, which I'll share next. Next slide, please, Carrie. So we did arrive at 2 goals based on the data that we received from scorecards. We have 1 goal for the acute care setting and 1 goal for the ambulatory care setting. For our acute care setting goal, we are going to ensure that all our providers receive training on trauma-informed care. And our success target for this particular goal will be to ensure that the education occurs at all 8 of our hospitals that carry out delivery. For our second goal, which is for the ambulatory care setting, we're going to ensure that every pregnant person during pregnancy and postpartum is screened for the social drivers of health, especially for food insecurity, homelessness and housing insecurity, as well as transportation. And our success target for this particular goal is to ensure that screening occurs at 6 of our OBGYN clinics. Now, in addition to the goals that we are pursuing for our quality improvement project, we are also collecting information on perinatal depression screening tools used across our member clinics. Next slide, please. So I wanted to use this slide to share a year at a glance of what our journey is going to look like, or currently looks like, for our quality improvement project. And just going back to Q1, which was really our foundation, and our foundation is starting off with the Bree Collaborative tools. Without those tools, we would not have been able to take this project off the ground or even feel confident that we could, first of all, arrive at our goals and have the tools we needed to implement them. Now, for the second quarter, we are now in the implementation phase. We are now working on ensuring that our providers are receiving the trauma-informed care training. We're now working on ensuring that our patients are screened for the social drivers of health. The highlight for our third quarter will be to begin collecting data while we're continuing our implementation. And then the highlight of our fourth quarter would be when we share the data we have so far with the Healthcare Authority and continue to review for opportunities for improvement, and also certainly continue to implement to ensure that we provide the care that our patients need and improve outcomes. I hope that with David and I sharing briefly our journey so far and how the Bree Collaborative tools have been very impactful for us, that it gives you some encouragement in what is possible with the Bree Collaborative tools and support. Thank you. And we are happy to answer any questions that you may have.
Thank you both so much. I am going to go back a little bit here to the first slides. And I was just hoping that you guys might talk about how and if you intend to use these other tools, how you can imagine yourself using them as you go through your implementation project. For example, maybe some of these, let me get back to it here. Sorry. There we are. So some of the survey banks or question banks or measurement banks for perinatal behavioral health in particular, there were some places where measures didn't exist. So for example, for pediatrics, there are not really standard measures. There were some recommended measures, but they're not standardized in any way. Are these tools that you guys imagine yourself using? Have you thought about them yet? Have you looked through them yet?
I'll step in and answer what our initial thought was and how we might use those. But we looked at this as being a multi-year initiative. And really, with that in mind, and given the diversity of our network, and this isn't the only care transformation initiative we have going on, we wanted to take inventory of where the gaps were. And that was really our biggest objective, and combine, some of the recommendations within this tool set and guidance provided by the Bree, to also kind of align with things that are happening, across the market, the healthcare industry. And so, SDOH screening is by far something that's becoming more and more common. And I know a lot of groups have been implementing it in, the hospital setting because of certain reporting requirements. They're starting to introduce it into the ambulatory setting. But a lot of that's really focused on primary care. And so this kind of helps us leap into, the OBGYN clinics, and some people might use their OBGYN as primary care providers, but it's really, from a health system, it's more of a specialty group. And so introducing this slowly across the system was part of the goal. And, when you introduce new processes, you have to be cognizant of how you can react to them. So if we're going to implement assessments in a new setting, what if there are positive results? Do we have the resources to address those? And so we wanted to pilot before we spread across more of our clinics, I guess, and understand really what those resources are. How I see us using the measures, which is getting to your question. That was our plans to do that in year 2. And I think part of the challenge will be how to track that within our systems that exist today, and setting that up. And today, the EHR is typically the best way to track quality. And so that might require optimizations within the various EHRs that our network operates on. And it can be dependent on the IT resources that each one of those EHRs have at their fingertips. So it would still be exploratory require exploration before we implement, but that would be the ideal. We also, our groups also report either to the maternal data center or OB-COPE. And as long as those processes are in place to report the appropriate measures within the health system, you know, that'll be part of that process. And hopefully, I haven't dived deep into the measures, but ideally those align.
I will be honest, David, so perinatal behavioral health does not have any measures in it yet. So we are very interested in hearing from folks like you about what you'll be using, codes, things like that. So yeah, this measurement bank is very, very new. There is a question in the chat too, from Stanley, and he asks, you have referred to this project as a quality improvement, but could you also call it an implementation science sustainment program? Has the evidence for the base of your program assembled as the whole program or as an assembly of individual components? So how are you thinking about this in terms of implementation science? Are you doing it component by component? Are you thinking about all the components together? And this might be a hard question to answer for perinatal behavioral health, because we did not create a matrix for perinatal behavioral health. This one was sent out before.
Yeah, I think it's definitely more, you know, I guess, task specific, and, you know, started out with the smaller tasks that we think we can implement instead of trying to implement everything all at once.
So thinking about it, implementing more of the kind of the elements of each one rather than a large component like education. Is that kind of how you're approaching it?
Yes, and you can, I would say, correct, yeah.
And another question has come in: how can these tools be adapted for use in developmental and intellectual disability settings? It's a very good question. I can give you my thoughts. So a lot of these tools are meant to be very high level and collaborative. So if developmental disability and is something that you're interested in terms of, say, perinatal behavioral health, you might try and find, to start with, in some of our collaborative forums, other organizations that are interested in working on the same thing. That would be one way that they could be adapted. And I don't know, our guidelines really don't talk a whole lot about intellectual disability or developmental disability for perinatal behavioral health. But you, David and Nkiruka, you guys are working on this, and you might have other insights into that.
So I will just add that we don't currently, you know, or hadn't planned or thought about, you know, this, you know, previously, but certainly something that we should consider as we walk through our quality improvement project.
Yeah, it's a really good question. These guidelines are narrow on purpose, because often we only have a year to develop them, and sometimes it can be difficult to tackle a very broad subject. But I'm glad that somebody asked this, because there are always going to be aspects that we were not able to touch on in the guidelines, and we are hoping that some of these more collaborative tools can help organizations address them regardless. The other thing I would say that audience members could do is fill out a scorecard and note to us what is missing. We would be very interested to learn what is missing on the scorecard. What are you wanting to improve on that we kind of didn't cover? So that would be another another way that we could do that.
And that's what I was going to suggest is just get started. Yeah, I think just completing the scorecard provides a good framework. And I don't think it depends on maybe, and we can see your screen right now.
Oh, I'm sorry.
And so, so I think, you know, like I said, we're a fairly diverse group of providers. So I think it's pretty applicable to such a diverse group. And a lot of these tools are. But just getting started and completing it is step one.
Yeah. And there's another question. Stanley says, thank you for your answer. I'm in a similar situation with a school-based asthma program with program components that we actually assembled. How do you anticipate scoring or analyzing your results to prove uptake or benefit? So I guess the question is, have you guys come up with the kind of your own components? Do you think that you might rely more on the Bree to help you sort through what the components of our guidelines are? Like, how are you approaching, you know, to demonstrate? And these might be difficult questions because I can tell they're more implementation science oriented rather than quality improvement oriented.
I think there's a clinical side, and I would defer to Dr. Duze on that, and then the administrative side, and kind of, I mean, so one thing that we see the value of these tools, and I mean, really thinking more about perinatal behavioral health for this example, but you know, this is innovate. Like, we learned that we're doing a lot with across our network, but there's a lot that can still be done. And this helps to impulse or push, catalyze us to address or evaluate what's missing, and then create that plan to fill those gaps. And from our perspective on the administrative side, I would say, you know, I think the big thing is we want to try maybe reducing, you know, complications in birth, as well as, you know, other complications to the mother. And one metric might be NICU stays with the population. You kind of need a large population and that, but that would be beneficial to, I think, everyone involved, because those NICU stays are very expensive. And when we're trying to improve the quality of care while reducing the cost, that's one big component with this population. And then the clinical side.
Yeah, absolutely. So I think to add to what David had shared, so primarily, at least for this particular prenatal behavioral health project, what we're going to be looking at, you know, is first of all, with our providers, did they receive the training, and how is that impacting the care? The trauma-informed care education, and how does that impact the care that they provide to their patients? And then secondly, with the second goal that we have, which is for the acute care setting and the ambulatory care setting, is just ensuring that every patient is getting screened for the social drivers of health, and not only stopping there, but, you know, having the resources to make sure that once we have a positive screen, that we can support our patients and improve outcomes. So essentially, I said that to say that the two primary areas that we're going to be focusing on for this project is, did we meet our goals, right? Did we provide the education? Did the education improve outcomes? Did we screen? And when we did screen, did we act on our positive screens? And did that improve outcomes? So that's what we're really going to be focusing on specifically for this particular project.
It sounds like you've used this tool kind of to develop your own intervention components by identifying the gaps, and you found the gaps were mostly in education and screening, it sounds like to me. Does that sound correct?
Well, so we did have several gaps. So these were the at least two that we picked from the areas of greatest opportunity. So there are other areas that we can improve on, but across the network, kind of using the numbers that we got from the scorecard, we were able to arrive at these are the two that we needed to focus on first.
Great. I think this is a really interesting question, and I will just go back to another slide here. For our, oh, my apologies, it might be going forward. Yes. So to answer your question fully, Stanley, this was one of the gaps as we developed these scorecards since 2022. Especially when we were going through like the perinatal behavioral health, I think that was a real catalyst for us to develop these evaluation matrix. And as I noted, perinatal behavioral health we didn't have the opportunity at that time to create one of these. And so at the Bree, we really hope that these collaborative measurement banks and question and survey banks, places that organizations can come together and talk to each other, will help them think through their processes and help them identify the components for themselves. It is kind of unfortunate that we were unable to do that year. But going forward, all of our reports will include these evaluation matrix, and it will be one other way that organizations like the Puget Sound High Value Network can draw from our tools as they're identifying their gaps and figure out like, oh, it fits into this education components here. This is what we're working on, and give them some metrics like, what are they suggesting we use to measure this? And does it align with what we want to measure? So that organizations can really have more alignment across the system, and also have these areas that the Bree can measure as well. How well did people do on education? Was it easier to educate than to give access, for example? Like, was there more improvement in one area than the other? And I saw another thing in the chat. Let me just check here really quickly. And the question is, are there champions at each of the participating sites to help support the work? And will these champions work together to share challenges and successes?
Can I take this one, David? I would say yes. Oh, actually, yeah, you take it, David. Okay, so we do have champions at each site, and we do meet regularly to go over how we're all doing, and we learn from each other. So yes, each site has a champion for all the quality improvement projects that we participate in within Puget Sound High Value Network.
David, did you want to add anything to that? Or?
No, I was actually encouraging Dr. Duzay to answer it.
Yeah, and I see Nora sent some information about our pediatric asthma, the Bree topics and implementation tools for that. And I can actually go right to that here. Yeah, so, clicking on these topics here, you can find under chronic disease management, you can find all of our guidelines. Here's our pediatric asthma. And here are our tools. So as you can see, like for pediatric asthma, we mainly have scorecards. However, we are developing, as we're developing case studies, so one of the things that we discovered is like we have ESD 105 that is working on pediatric asthma, and they didn't have a great way to share all the stuff they were doing, their surveys. So as they were working on that, we developed our bank and our survey bank. And so now, as I mentioned before, these surveys are available to everybody. So the tools that they developed can be completely shared out across all of these different topics. And as they are finishing up their case study, then that case study will be posted under this topic right here. It will be posted in this section. So we will add it here in examples of implementation. And other organizations can go and see how they measured it, how they structured their evaluation, what they were interested in implementing, because most organizations like you guys are only going to do a few guidelines because it's a big, heavy lift. For this one in particular, they chose to look at asthma care plan improvement. So it was just one line in that scorecard that they chose to look at. But all of our guidelines are very big lifts. And I don't see any more questions. Beth, do you want to just hop on and let me know if there are any more questions in the...
None in the Q&A that I see. Please continue to drop them in the Q&A if you do have more questions, please.
Yeah. And so I wanted to wrap up today by giving you guys an opportunity to talk about the other kinds of tools or involvement that you've had in the Bree so far, to give people a little bit more perspective on kind of your relationship with the Bree and how that has impacted your work as well.
We have been implementing Bree Collaborative initiatives since 2016. So I've been part of the organization since 2022, but we've implemented spine and total knee bundle Bree Collaboratives, and as well as the lower back pain. I know Dr. Duze, did you include that slide of all the initiatives?
Sorry, I had taken it out.
Oh,
well,
there's a
slide.
yeah, there's a variety, and some of them are not things that I would say. A lot of the quality measures that we're looking at are really dictated by sometimes the payer-provider relationship that we have. And these are measures that are not typically on those types of, agreements we have. So they do drive change in a particular area and bring focus to it, which is great. And what we've learned is you'll find people in the organizations that are like, this is their passion. And, it's really tapping into those groups and working with them and engaging leadership as well to get this on the radar as well. And then setting up the systems that are needed to collect the information and then be able to report on it. And those take time to establish it, and they can require some type of investment. So it does require potentially the leadership involvement to be able to make those types of investments in new reporting structures.
Thank you, David. It's I think a very important piece, and it is one reason that we made scorecards for like the administrative side, to help get them involved and engaged in this work too. And I would just mention there's lots of opportunities for anyone on the webinar to participate. One of the best ways that I think organizations can start is to start by participating in our evaluation subcommittees. So these are subcommittees are primarily built off of our work groups, but anybody can join them. And they are focused on the topics that we're working on that year. So we design all of these topic-specific tools in that subgroup. And anybody who has expertise in evaluation or expertise in that topic area, or is just planning to implement these guidelines in their own organization, can come and join and give information and feedback about what measures they plan to use and how they plan to evaluate, so that we can come up with a very good framework for how we're imagining change might happen, and then how we're measuring the change might happen. So I wanted to, in our last few minutes here, I wanted to bring your attention to some other opportunities that we have. So we are scheduling 2 more webinars on this same topic of measuring change. The next one will be in July, and it will be highlighting one of our case studies that is using our opioid guidelines and our metrics they've created prescriber-facing dashboards to help them prescribe, to help them be more accountable to their prescribing practices and to their patients. And so they're going to be talking about their chronic opioid therapy program and how they've used our metrics to develop those dashboards for their providers. And then in September, we are going to be doing a webinar that is kind of a roundtable of speakers who will be talking about other sorts of frameworks and how they can align with the Bree guidelines. So we are hoping to have some tribal perspectives, maybe some rural perspectives. We're still gathering our speakers for that webinar, but I think it will be very interesting. And then our most recent kind of, I guess it's a tool that we've come up with, is an engagement tool for evaluation forums. So these are one-time meetings for each topic where organizations that are implementing these topics can get together and look at the topic-specific tools. So look in depth at the matrix that goes along with that topic, or with the framework that goes along with that topic, and talk to each other, share ideas, even just share like timelines when they're going to do it, that sort of thing. So these are in a series from May through September, and you sign up for the series, but you can attend any or all of them. It's totally up to you. And I also wanted to give some information about how to stay connected with us, so that as we roll out new information and new opportunities, you can follow along. So you can always check out our website. We have an evaluation blog, and often I talk about like who's doing a case study and what kind of new tools we have, and what are some priorities that we're going to be working on for evaluation. And I also wanted to share information about our guest speakers and our staff so that you guys can keep in touch with us. These slides will be sent out, and the recording will be posted as well and sent out to anybody who was registered. So with that, I think, Beth, you wanted to add one other thing?
Yeah, thank you. It's good to see so many familiar faces on the call today. My name is Beth Boschkoff. I'm the Director of Research and Best Practice at the Foundation for Healthcare Quality. For those who I have not met before, thank you for being here today to learn about these great tools and the Puget Sound High Value Network. Really thankful to have them here to speak about this. There was a mention about things that may have been left out, or maybe not as extensively included in guidelines or reports that we develop. And I wanted to just give a quick plug. We will be sending out soon in May our topic selection survey. We try to get feedback from our community and our networks on topics that you think would be appropriate for us to address in the following year. And so we look at every suggestion. There's no limit to the number of suggestions you could make. And we really value your input and guidance in what's affecting your communities and the patients you serve. So keep an eye out for that and sign up for our newsletter to get it in your email. Thanks, Carrie.
Thank you, Beth. And Dr. Duce and David, thank you so much for participating and talking to us today about how you're using these new tools that we've developed. We really appreciate your input and your insights into their usefulness and also what still needs to be worked on. It's been really valuable to us to hear from you as well, and we greatly appreciate it.
Thank you for having us.
Yeah, thank you. All right. Thank you all very much for attending, and we will be sending out materials after the webinar. Have a great day.